and watch, but we do a lot of it here, and you might not know that, but like, for example, if you have a husband who snores, like they might have a BPA septum, like little things that like people come in for all the time that I feel like we just don't talk about. So it's almost just like airing out like the taboo category of mandated plastic surgery.
What's up, everybody? Dr. Barrett here. We're going live. We just finished a nice day of surgery. We did a tummy tuck, and we did a breast augmentation with an internal bra lift, which was pretty cool. Haven't done that in a long time. Okay, guys. So, hello all the way from India. Hyderabad. I don't know where that is, but that's cool. Welcome. I'm sure it's pretty late over there right now. So you guys, water fast paying off. Lola got sold. That's awesome. I'm glad to hear about that. Water fasts are amazing. They're a great way to kind of, reset your body. Thanks. I'm looking nice and shiny. I'm trying out a new skincare, you guys. Let me see. Let me clean this little fuzzy les one here. Trying out a new skincare. So we're going to see how that works out. But if it's good, I'll let you guys know. Checking all the sound. Can everybody hear me okay? You guys good? Okay, we got, so San Diego, what's up? I did your mommy makeover. How are you? Good to see you. And where are we? Hi from Canada. Where in Canada? Hi from New York. What's up? Those are all places I love. Been to Victoria, Banff, Montreal. I used to go to Montreal when I was a kid. Hi from Italy. Hola. Hello from Egypt. What is up? You guys are on fire today. Everybody from around the world. I'd like to get a breast augmentation, and I'm on the fence about it. What do you suggest? Kim, well, I'm not here to twist your arm. Check out my videos. Breast augmentation is something that can really kind of change your life. But today, we're going to get started. We're going to talk about our topic, and then we'll dive into some questions from you guys, okay? Time willing, probably have about 30 minutes. I'm going to put these a little bit closer together so it looks like I'm looking at all of you at the same time. Okay, perfect. Here we go. Great. All right. Puerto Rico, hello. You know, I was actually in Puerto Rico not too long ago. We had to go from St. Thomas to Puerto Rico to get fuel because there was a fuel shortage. So hello, and hello from Iraq. Hello everywhere. Wonderful. So all right, we're going to talk about male plastic surgery. So there's over 1 million men who undergo cosmetic surgery, and a lot of people don't hear about it unless it's botched, right? Like Simon from, gosh, what is that? America's Got Talent, right? So everybody was like, what the heck happened here? And I actually did a special TikTok on that. There's a lot of procedures that men undergo. And statistically, nationwide, about 90% of cosmetic surgeries is female and 10% is men. It's still a lot, but in my practice, it's probably more like, I would say 20%, maybe anywhere from 15 to 20% is actually men. So that's anything from Botox fillers to tummy tucks after massive weight loss. Male gynecomastia, this is one thing that I kind of specialize in because I've had this procedure myself. And what do we do? That's if there's an excess of glandular tissue, right? What else? I do male rhinoplasty. I just saw one today. He's looking fantastic. There's facelifts. We do facelifts. There is a lot of fillers that men are getting now. Lips. We did a lip filler patient. You can check that out on my Instagram, by the way. If you're on TikTok, you want to follow my Instagram, check it out, Dr. Daniel Barrett. If you're on my TikTok, if you're on my Instagram, you want to check out my TikTok, it's Barrett Plastic Surgery. I have great content on both, so check it out. And if you guys are on YouTube, check out both of those. It's a great resource for a lot of stuff that we just put out there on a regular basis, including men. So septoplasty is also a real thing. So like if you're snoring at nighttime, or your husband is snoring, or your boyfriend is snoring, that is something that could be possibly corrected with a septoplasty. So I've had several surgeries myself. I had the gynecomastia surgery. It wasn't by a plastic surgeon. It was by a general surgeon that left a big open scar. Wasn't happy with it. Did a shark bite. I developed an endoscopic way to do it, but that's a very common thing. Why it's becoming more common, I'm not quite sure. There are a lot of endocrine disruptors in our environment. So there's a lot of testosterone blocking things that are out there. So like this applies to everybody, by the way. Don't eat your food in plastic. Stop wearing perfume. Stop wearing cologne. Stop taking so many showers. I rarely, I used to take a shower every single day. And I washed my hair all the way down to my toes, like full on soap every day. I was like, and then just recently I was like, why the hell am I doing all this? It's just like, do I really smell that bad? I don't think I really do. And so I kind of cut that down. I really minimize like how much soap, and I use very natural soap and stuff like that because I'm trying to limit a lot of these aromatic compounds in contact with my body. You know, the hair gel I use is very minimal and it's organic stuff. You know, trying to limit the aromatic compounds in our body so it doesn't disrupt hormones. So testosterone is one of those things that can easily be blocked by these things. So those are little pointers there if you might be having some issues or if you know somebody might be. Now, once you have the male breast growth, it's really hard. It doesn't really go away. So then you have to do the surgery, which I'm here for. But ideally, we all learn how to kind of prevent some of these things if we can. And sometimes it just happens genetically, and it is what it is. Same thing with rhinoplasty, right? So we do that as well. A lot of doctors don't do male rhinoplasty because they're very particularly challenging. The nose is very strong. You don't want it to look like a Christy Brinkley nose, right? Like a little ski slope. You want it to be straight. So there's different ways to do male rhinoplasty than there is to do rhinoplasty for women. In terms of the competitive nature of, at least here in LA, a lot of men are getting Botox. They want to look younger. There's a strong pressure to look younger in the workplace, whether you're male or female. Especially if you're in the show business industry, you know, there's a strong pressure there. Skincare, people don't want to look, they want to feel what they feel like inside, whether you're a man or a woman. And so men especially, we're removing the taboo, especially here in Los Angeles, of getting Botox. And people call it Brotox, right? But it's you know, I get Botox, I get it on my forehead, I get it brow, I get it on the sides of my eyes. Definitely helps me look younger, looks more refreshed, I look less tired, and it also helps the skin quality, okay? We do a lot of hair restoration, okay? That's another thing that actually many men get this, but also some women, believe it or not. But we'll just focus on the men, but because that typically, you know, we're talking about men. So, you know, with hair restoration, we come out with new product using exosomes. Exosomes are tiny little healing packets that stem cells produce. Okay, so previously, like, people use stem cells. Now we're switching to exosomes, where it's these tiny little molecules that are filled with healing molecules. And they go out and they're just like, poof, they release all their goodness, okay? And so when it comes to hair follicles, it rejuvenates them. And when it rejuvenates them, they start growing hair again, all right? So we combine it with microneedling, which increases blood flow. We fill it with exosomes, so we get it released. We inject with exosomes. We do red light therapy, and then we also have supplements to do it as well. It's Viviscal. It's like shark cod oil or something like that. We'll have to look that one up. But anyway, all of that stuff helps hair regrow, and that's a big thing. Luckily, I haven't had any hair issues myself, but I wouldn't hesitate to do it if I did. I know, knock on wood. There's no wood in here, and maybe in that machine there's somewhere wood. Okay. Brazilian butt lift. Yes, this is a very popular procedure that women get, but men get this as well. I have lots of patients that come in. We take fat where we don't want it, and we put it where we do. Now, for men, it's a little bit different. We want to go for a masculine V shape if that's what they want, but typically they do. So you can highlight the latissimus coming down so that it looks like that. And then we typically want to do posterior projection, right? Posterior projection for men, right? Not side hip projection, right? We're not looking for hourglass shape. So that's why a male BBL is a tiny bit different. Sorry, I'm turning off my phone. Definitely do liposuction for both men and women. Men have stubborn areas, especially the love handles. No matter what you do, you know, your body is just hardwired to put that fat in those extra areas. And then, let's see, what else we have? Jawline enhancement. This is a good one, you guys. Chin implant, or even a jaw implant, or jaw filler, chin filler can make a huge difference. I have some male actors that come in and we do this, or just men in general. It's like if you have a weak jaw, like, it just makes such a big difference if we put a chin implant in and then all of a sudden you're like GQ. You know, it's like, whoa, your whole life changes, you know. Sometimes we can combine that with a rhinoplasty, but we don't need to. I do lots of chin implants. And then if you have a little bit of extra volume under here, we could do liposuction on the neck to really kind of slim that in and make that look even more angular. We have a no scar neck lift, which we also do with Renuvion, so that instead of doing a full-on neck lift with a big scar, bring it all back up. We have a minimally invasive option where we go in with Renuvion, which is a skin tightening device that tightens up the neck and face, and we follow it up with Venus Legacy and CO2 laser to really further tighten it. So those are a lot of the things that we do for men. I mean, like, you know, despite, you know, people not talking about it very much, it's quite common, especially in my practice, and it is quite beneficial for those that are interested in it. So, let's see, did we cover everything you want to talk about? Oh, okay. So what's it? Oh, eyelid surgery. Yep, men need eyelid surgery. That's a functional and cosmetic thing, just like women. And sometimes you can combine it with a brow lift, but I generally stay away from brow lifts because Google Kenny Rogers. Yes, Kenny Rogers. He had a way overdone brow lift, and men are not. Nobody should have their brows like this way high. Men should have their brows kind of right on the border of the brow bone. And it's okay if it comes down a little bit low, but you don't want it to go on top of your forehead, right? So that's why I stay away from brow lifts. But if you get extra eyelid skin, you can remove that skin. And sometimes there's so much skin that interferes with your vision. So if your eyelid skin is actually touching your upper lashes, it's pushing down on your eyelid, you may want to think about getting a blepharoplasty, okay? So it's kind of a nice procedure to improve your vision and look good, look more refreshed, you know, wide-eyed and bushy-tailed. Okay, so questions. If anyone has has any questions about male procedures for themselves, their spouse, their partner, brother, or friend, what questions do you have? Let's get into it. All right, the laser that does the lifts, please. It's Vernuvion. That's what we do. How big is big for augmentation for average-sized women? Well, that's a good question. It depends on a lot of things. All right. Okay, guys. Questions about male plastic surgery? Okay. Oh my God, Dr. Barrett, Illy King. I'm not sure that is. Okay. Are there male butt implants? Yes. So that can also be done. Again, I generally try to use fat because when it comes to the implant, there's very firm for buttock implants. Okay. So you have to sit on your butt a lot, right? So there's more complications, and sometimes there's a higher risk for. Actually, there is a higher risk for infection when it comes to male or female buttock implants. That's why I generally try to avoid them, but it can be done, and they look pretty good. But when you feel them, they do feel firm, and when you sit on them, you can kind of feel it. So it's not for everybody, okay? What's the gynecomastia surgery? Well, gynecomastia, again, is that male breast growth, and I do endoscopic approach, meaning I use 2 dots right here, and I go in endoscopically to remove the glandular tissue, and then I do liposuction, and then I tighten the skin with the thermal cautery, and then I close it up. You don't have a big scar on the areola. You just have 2 dots right here and right here, and that helps the chest go down, okay? My practice is in Beverly Hills. We have people that fly over from all over the world, all over the country, and we do their surgeries. So, okay, so let's go back here, see if we have any other questions. Please follow, guys. I want you guys to see the new content as it's coming out. We have a lot of stuff. Check out my YouTube page, Dr. Barrett Plastic Surgery YouTube. All right. I've got tons of in-depth videos. So if you want more information about these types of things, I have gynecomastia videos. I have BBL videos. You gotta subscribe, check it out, and give me a thumbs up if you like the videos. Now, if you're also, if you want to see real content that's coming out live pretty much every day, as we do, check out my Instagram, Dr. Daniel Barrett. We also have Barrett Beverly Hills. And then if you want some fun, entertaining stuff, check out my TikTok at Barrett Plastic Surgery. All right, so question, what is a chin implant? A chin implant is a firm silicone implant that we put through a tiny little incision here that nobody really ever sees, because most people have a scar here from when they hit their chin as a child. And it goes in here, and generally I do an extended anatomic. I have not had a chin implant. I've not had a jaw implant, I promise you. But people ask me, and I'm like, thank you, but no. It's just for my parents. But anyway, you can also do a jaw implant too to bring that out here on the side, which is also a permanent procedure. Okay, it doesn't, no need to kind of refill it. That's why, like, when it comes to doing filler versus an implant, I generally recommend doing an implant, because filler you have to keep doing over and over again. It's about $1,000 every time you do it, and it lasts only about a year. So, abdominal etching. High definition liposuction for men, yes, I do. That's if you want to liposuction, if you want to do liposuction in a way that highlights your underlying abdominal tissue, muscles, you can do that. So basically you get a little line here and kind of like a 6-pack on the side. Also, it's important to highlight the side abdominals. That's something that I also do for men, typically in conjunction with a fat transfer to the buttocks, okay? Is Botox safe? Yes. Very much safe. It came out in the 80s. People realized they were getting it for headaches, and they realized that, hey, this is also good for wrinkles. And then it just took off. And it's extremely safe. It is a mild toxin from bacteria, but you know, whatever doesn't kill you makes you stronger, perhaps. No, but they've actually done numerous studies on it. The small amounts we use for cosmetic injections doesn't come anywhere close to causing botulism poisoning, which is paralysis of your diaphragm, right? That's what you want to worry about. Is there such thing as a mini tummy tuck? Well, yes, there is, but generally we try to avoid that because most people need the full, right? So if you have belly button, this is good for men or women. If your belly button's a sad face, it means you have extra skin up top. And the too much extra skin on top, the only way to get to that is do the full, okay? And then if you need to fix the diastasis, you need to do that plication as well, okay? All right, is that good? All right, guys. Well, that's it. Thanks, you guys. We're going to go live every week, I hope. And so we give you some more information, so stay tuned. And again, follow me on YouTube, Dr. Barrett Plastic Surgery on YouTube, and check out my Instagram, Dr. Daniel Barrett, and my TikTok, Barrett Plastic Surgery. Thank you, guys. Have a wonderful night.